AudioJungle.
ಇಲ್ಲ ಸರ್ ನಾಲ್ಕು ಬೇಕು. Hi all, welcome to Medicall. Medicall is India's largest and biggest medical device trade fair. Here, whatever a hospital needs, right from the syringe to ambulance or anything, it goes to creative exhibitors, all over manufacturers. So, any hospital owner who is trying to build a hospital or trying to equip the hospital better, you have to visit Medicall. And if you spend 4 to 5 hours here, you can plan for the entire year's come. Please come. It happens in ITEX today and tomorrow. Yesterday was the first day. Today was the second day. We have excellent response from a lot of doctors and hospitals. Please do come. Thank you. Response is very good, sir. Response is very good. A lot of doctors and hospital staffs are coming.
And how many delegates are participating?
We are presenting this world's first ductless laminar airflow system and modular operation theatre project. This system does not require any of the space to keep the air handling unit. This is the highly compact combined with the HU and laminar put together, where the depth of the system is just 1.5 feet. This will help to maintain air sterility 10 times better than the conventional systems, and it will help to reduce the recurrence cost. This system is a next generation system, and it reduces the chances of having a surgical site infection to the patients, and it reduces the recurrent costs of the hospital. This system is a highly compact and it's a next generation system. Thank you. The response, whatever I have observed at Medicall, is a very good. I have seen the number of doctors visiting is quite often that today also we have seen more number of doctors are coming to the Medicall. Operation theaters, ICUs, NICU, SICU, PICU, IVF lab and cath lab with clean rooms also. So this is a highly compact system. Thank you, sir. We are presenting this world's first ductless laminar airflow system and modular operation theatre project. This system does not require any of the space to keep the air handling unit. This is the highly compact combined with the HU and laminar put together, where the depth of the system is just 1.5 feet. This will help to maintain air sterility 10 times better than the conventional systems, and it will help to reduce the recurrence cost.
And it is a own manufacturing center owned by us. Anything we can ask for it. It is related to the hospital interiors. Thank you. This is good. People are coming. New hospital manufacturers, builders are coming to us. Doctors as well as architects are also coming. It's a good thing to know. And the inflow is good. मन में आए बेटा
Hi, this is Sami from Bapuji Surgicals. We are into surgical dressings and hygiene care. We have a very unique product which has been introduced, Dermal Matrix, which is a collagen-based product. Thank you very much. Please visit our. Response is really good. Yesterday it was good. Today it's been started. So since it's a Sunday, we are expecting some more products. And who is the last one? Clients, I mean, today we have some around 50-60 walk-ins. Yesterday it was quite good.
We are from Sensotronic Instruments. We are at Medical 2026. We are presenting Matchtech data loggers. Data loggers are used to record temperature, humidity, pressure, various parameters during the various process like sterilization, lyophilization, and cold storage monitoring. We have various type of data loggers.
And how is
A lot of visitors are coming, and we are happy to showcase our product and give them the demonstrations.
Next day or make the patient to come next day. So normally an MRI protocol, that is if you are doing an MRI brain, it will take 35 to 40 minutes to complete the scan. So in every hospital we can feel or we can hear the scream of patients who are waiting for it. Always they shout at the receptionists, they shout at the operators for the delayed scanning and delayed report systems and everything. So where adopting this A-driven solution. A is the solution used to simplify the job and to speed up the job or to ease the job. So SwiftMR, it reduces the scan time. If your scanning time is 35 minutes to 40 minutes, what we say, we optimize the protocol and make the scanning time to 10 minutes, within 10 minutes. And our AI-driven solution, our AI package will give you an enhanced image, recon image, and the complete scan will get completed within 12 minutes. It is very simple very simple, just scan it, send the image to the server, and the images will be enhanced there and it will come back to the radiologist PAC system. That's it. So this solution is used across the globe, and this is FDA. This is the one and only solution for fastest MRI, and it is already approved by Siemens Healthineers. Siemens is radio diagnosis equipment, and it is deployed in AWS cloud space, is Amazon Workspace, and other hospitals across the world. See, these are the places where our team, 35 plus countries, 970 hospitals, and it is about 4,20,000 scans being done. And CDSCO approval has also been done for this product. Several practical trials with all the machines, from the old generation system to the current generation system we have did, and we have seen the swift, fast acting performance of the machines, and it is very supportful for the radiologists to maintain workflow and the reporting. So why you need a presentation? MRI exams take too long. Why MRI exams take too long is, if the exams, the time on the scanning is more, the image quality will be good. Long and uncomfortable exams. If the patient is very old or a kid, the patients will give you a movement artifact, and the non-cooperative patient will make repeated scans. And hence you can do one, and return on investment will be very delayed because of limited studies what you are doing with 15 and 20 patients. And appointments will be following up, and it will be flowing up. The patient may sometimes go out of your diagnostic center or the hospital saying that MRI is taking more time, and let us take an MRI from other places and come back to your hospital. Here we are working with choice between the image quality and scan time. Normally people, radiologists, even doctor says, if the scan time is reduced, the image quality may get blurred or the noises will be more. But what we are doing is reducing the scan time. We are giving patient comfort and productivity for the same scan, which is from a machine. The left side is the accelerated scan. Standard scan is normally by 20-30 minutes. Scan image, scan time The standard scan by 4 difference of image quality. 4 minute scan, you have taken long time to make the scan of 4 minutes, but the image quality will be this is like it's less than 2 minutes. If your broadband is good and if your system is clear, within normally what we say in this is instead if you are doing a 30-minute scan, it's been reduced to 10 minutes, and along with the 10 minutes you add another 2 minutes. Within 12 minutes, your complete scan will get complete. Your complete scan. So patient screening, saying that the huge time. And in the previous meetings, you heard about the patient's cloud. Likewise, you can go for an on-premises setting. So if it is of an on-premises setting, all your data will be there in your hospital or in the premises. We give an open choice to the customer, to the hospitals, whether you want to select an on-prem solution or a cloud server. Now, normally nowadays what we do is on the demo. This has a demo process. We give demo on cloud. Anyone can decide whether it can be done in on-prem solution or with cloud server. On on-prem solution or cloud server, the complete workflow and operation time only within 2 minutes. 2 minutes it will happen. Patient because of long scan, anxiety and discomfort. So using SwiftMR, once again, we acknowledge that the scope without compromising the image quality and signal to noise. Again, we say that the shorter scan time, the image quality will be great. So SwiftMR is an FDA approved this solution, and we are getting benefited of this. In your upcoming smart hospitals, if you're planning for a radio diagnosis system, you can very much plan for SwiftMR for enhancing the image quality and making scans easy and the patient to feel a fastest scan in the city or in the state. Very much adopt this technology without ask people, but usually we can provide you complete a demo session that you can try out, or if you want to take it, you can take this technology inside your upcoming AI smart hospitals. And we are in others competition of product. This is MR. Why we are in the country, even in the government setup, MRI is limited resource. As it is expensive, we
is efficient and easy to use. Some benefits of ultra-low dose radiation include extended X-ray tube life and, of course, an increase in patient and staff safety. Visit the Clark.
What we are talking about very old technology up to 128 and 256. Now the current present technology of various manufacturers in the market. So this normally some manufacturers like Siemens has low dose system inbuilt into the machine. In Siemens they call it as an CARDOS. Based on the patient weight, the patient BMI index, the machine decides what is the dose to be provided, what is the MAs to be given on this particular scan. Well, if you're using Clarify, apart from that, if a Siemens machine, their BMI index says only 80 MA to reduction, another one is to reduce the contrast agent. That plays another crucial role in the scan. Normally 100 ml of contrast is being injected on the patient, or 50 ml of the contrast based on the studies and the body part. So if it is a 50 ml of contrast has been loaded, iodine boosting. The contrast is nothing but iodine boosting. So if with 50% of contrast, the A engine works on the iodine layer and it enhances the layered iodine area on the B solution. A part, A engine, A boosting engine. And you can visit our stall. We have a stall here in D2. This is once again I say this is only AI-driven solutions, proven engine available in India with FDA approved. If you have any ideas or if you want to incorporate any of the AI solutions, we have a mammography solution, we have thyroid solutions, and plenty of other solutions. We are working on AI shoot for the computer workflow. So if you have any doubts, if you want to know more about the AI workflow or AI integration, you can join with us in our stall. We'll be happy to serve you, give you more clarity, ideas on this product. Thank you.